So I have the privilege to work at UI Health Miles Square Health Center. This is a federally qualified health center system located in some of the highest need areas of the city. We see all patients regardless of their ability to pay, with the mission of providing primary care, but also addressing unmet community health needs. And this includes mental health as well as addressing the opioid crisis. In 2019, we wanted to focus on addressing the opioid crisis and improving mental health access. And we did this by developing an integrated collaborative program within our clinics, including an interdisciplinary team that included mental health providers, primary care providers, pharmacists, nursing to provide that integrated care. Our goal was to expand access and improve quality of care. Through this program implementation, we were able to expand access and increase the number of visits of patients cared for in the communities we served. As you can see, we started out about 700 visits per year and increased to about 23,000, so improving access, as well as integrating and expanding the number of patients cared for with opioid use disorder. As many of you've heard, there's been a significant crisis in the city, and this is an old epidemic that we have. Of about the 900 patients we saw that year, 817 were started on medications for opioid use disorder, which is the standard of care for patients with opioid use disorder. In addition to improving access, we also focused on ensuring our patients received evidence-based and quality care. We were the recipient in 2023 and 2025 of the National Quality Leader Award. And this is wonderful, but as a family doc who works in behavioral health care, I care about a person's whole health. And as you can imagine, those with mental health conditions, those with substance use disorders, historically have not had great access to primary care services. And in fact, 70% of our patients with opioid use disorder did not have a primary care visit in the past 5 years. None of them had a recent pap smear to check for cervical cancer. None had mammograms to screen for breast cancer, and including none had colorectal cancer screening. And so after initiation of this program within this integrated system, 90% of the patients were seen by a PCP within 4 weeks. And this allowed us to increase access to cancer screening, preventative health, chronic disease management. And in fact, 24% of those patients ended up with 3 or more chronic health conditions like hyperlipidemia, hypertension that needed continuous care. By focusing on meeting community needs through an innovative and integrated lens, we were able to have patient impact beyond mental health care. Our goal at Miles Square Health Center is to provide whole health care. Thank you.